Hi, so this is a little overview of the part of labour that happens in between the first stage or phase, the opening phase, and the second stage, which is the pushing phase, and that is transition. Transition might pass you by without you even noticing. For some people, it just doesn't even kind of come into their radar. For other people, it's the most challenging part of the labour. So what exactly is happening during transition? Well, essentially the cervix is going from roughly 7 or 8 centimetres dilated to full 10 centimetres dilated, fully dilated. And those muscles that were sort of softening and drawing open during the first phase are then purling up and forming at the top of the womb or the fundus to help push your baby down. Usually, but not always, some women are very quiet. Usually there is a definite shift in energy and noise. So the noises become much more low, much more guttural, primal. Most likely you'll feel a strong urge to push or definitely a strong bearing down sensation. It's often described as really needing to go for a poo, and that's because your baby's head is really descending now and pressing down on the cervix. And most key is there is a surge in adrenaline. It's really the only time you want adrenaline to be involved in the labour process. And that surge of adrenaline can often make you kind of lose your nerve in a sense. Sometimes you might feel like you want to run away, you definitely can't do this anymore. You might actually request pain relief and not wanting it the whole time during your labour, but now suddenly it feels unbearable. It's good to know that this is caused mainly by this surge in adrenaline, and it's all completely normal. So even if there's a slight panicky feeling, it's all very normal, and it's very important for your birth partner to be aware of this shift in hormones and this shift in energy so they can support you through this process, reminding you it's not going to last forever, you're doing amazing, you can do it because you are doing it. It can last around 20 minutes, sometimes up to a couple of hours, but really it's a beautiful time because it signifies this shift in your labour, shifting into the next phase, the pushing phase, where you're going to be bringing your baby up into your arms. I hope that was helpful. Stay tuned for more little bite-sized videos to inform your birth. I'll be doing more around the different phases, different rhythms of labour, and be sure to subscribe if you want to be the first to see them.